Let's discuss in inspection the tongue. The tongue is directly or indirectly linked to all the visceral organs and thus closely reflects the state of qi, blood, and body fluids. It is a mirror for the internal organs, so inspection of the tongue is one of the most important techniques of diagnosis. Number one, basic tongue diagnosis. Different parts of the tongue corresponds to different visceral organs. The tip of the tongue corresponds to the heart and the lungs, the middle part to the spleen and the stomach, the root to the kidney, and the two sides to the liver and gallbladder. However, any clinical information so obtained must be analyzed in conjunction with the information about the coating as well as the texture of the tongue. During inspection of the tongue, the patient should face the light with his tongue protruding naturally for observation. Inspect the coating first, then the body of the tongue. Pay special attention to the effects of the light and the seasons, and disregard the staining due to food, drink, and drugs. So here is the illustration. Um, the frontal tip is the heart, the center is the spleen, stomach, the sides is the liver and gallbladder, and the posterior part, the root, is the kidney. The contents of the tongue diagnosis, inspection of the tongue encompasses observation of the texture and coloring of the body and the coating of the tongue. The body refers to the structure of the muscles and blood vessels of the tongue, whereas the coating refers to the residue of the surface of the tongue. In Chinese medicine, the coating is formed from steaming by qi ascending from the spleen and the stomach. The body of the normal tongue has these features. It is supple and nimble. Its color is slightly red and bright. It is neither fat nor thin, and it is normally shaped. The normal coating is thin and white, moist but not wet, and neither greasy nor sticky. There are clearly discernible grains that are evenly spread. These grains are rooted and cannot be scraped off. The normal tongue is usually characterized as a light red tongue with thin and white coating. It is important that the tongue and its coating are analyzed together, but there are differences in emphasis. In general, the tongue body is more important for assessing the state of the internal organs and the tongue coating for assessing the degree of severity of the illness and the adequacy of stomach qi. Thank you for your attention.